So right now I'm on my way to the hospital. I'm about to go and shadow an orthopedic spine surgeon, and I wanted to tell you all some tangible tips that you could utilize in order to get a good shadowing experience, to even get a shadowing experience and make the most of it. So first and foremost, you want to find compile the list of doctors that you want to shadow, the types of doctors that you want to shadow. You want to gather their emails. You basically want to prospect. So look up the type of doctors, Google search, LinkedIn search those doctors in your area and try to figure out their email. And then I would have a template that you would send out, and hopefully you would get a response from one of them. You have at least like 10 or 20 or even more on that list, and you may hear back from like 10 of them. And then you can decide who you want to shadow and how you want to set it up. It's going to be important to shadow just to get experience in the field that you may be interested in, because you really won't know what specialty you want to pursue until you actually observe and see what they do on a day-to-day basis. Number two is, when you do hear back from them, be professional, respond timely. Don't take it personal if you don't hear back, but when you do, definitely want to be very quick with your response to solidify that time slot, because trust me, there's other medical students, other pre-med students who want to shadow that doctor. Another advice that I have for you all is to be professional and show up on time once you get that shadowing experience. Once you locked in that date, you want to make sure you show up in the clothes, the attire. Make sure you ask them how you should show up, if you should wear scrubs, if you should wear business professional. And you just want to show them your best self. I shouldn't have to tell you all that part. Whew. This is a long walk, y'all. I was like, I'm gonna be a little bit more healthy today. I'm not gonna drive to the OR, I'm gonna walk it. You can hear me, I'm running out of breath a little bit walking to this clinic. And so if you're interested in shadowing a surgeon, then I would recommend possibly having the experience, getting the 2 opportunities, if you can, to shadow in the clinic, so you can see them before pre-op, so you can see that interaction, that patient-physician interaction, what it looks like before surgery, which is usually you dress up for that. And then the other experience would be the operating room. So I would ask them for both, so you can see both sides of it, see if you like clinic and the OR. And if you get inside the OR, please wear comfortable shoes. These are the shoes that I'm wearing today. Hold on. I'm wearing these. They're Brooks shoes. So I'm wearing my Brooks tennis shoes. They're walking shoes. And I'm also wearing compression socks. Don't be like me on your first day in the OR and literally the first day of spine, y'all, my feet were burning. I don't know if it's just because I haven't been used to just like I'm standing up for a long time in the OR or something. I don't know. But my feet burned so bad. I had 2 procedures that stood up in for 10 hours a day. One, or about 10 to 9 hours. One was 4.5 hours. The other one was 5 hours. Spine, the procedures are long. So definitely know what type of operations you're getting into, so you can know what to expect and how long you're going to be standing for. Because you're literally just standing, and if you get the scrub in, which I got to for that procedure, I was, it's a certain way to hold your hands. Your hands cannot go below like your chest, almost. So if you're in a surgical sterile field, you have to position your body in a certain way, and it's very uncomfortable when you're standing for a long period of time in the same position. So definitely wear comfortable shoes and stretch before you go into the OR. Okay. And other recommendation I would say is learn to be helpful. Learn to, once you go there a couple times, if you have the opportunity to be in the OR a couple of times or in the office a couple of times to shadow, learn what they like. Learn what type of equipment, what type of materials they need, what type of things they do. Learn their routine so you can help out and be helpful, pass them certain tools that they might need. Just, not be in the way. Just learn what they see, observe for the first few times, and the next time then you're like passing them preemptively what you know what they're going to need next for the procedure or for the task that they're trying to do. Just always be helpful. You want to be able to make the resident's life easier if you're shadowing a resident, or you want to make the attending's life easier if you're directly reporting to the attending when you're shadowing. So definitely be mindful of that. And number 5, y'all, I would recommend y'all to ask questions. Being curious, be inquisitive. Always show that you've done your homework, learn about the procedure that they might be performing or a certain condition that they might be treating, certain specialty. Ask questions, have questions prepared so that you're engaged, show that you want it, you want to be involved, you want to be there. And then the other tip I would say is be prepared to be pimped. Like, don't be scared. It happens to the best of us. It's okay to not know the answer. It's okay to get things wrong. I've gotten things wrong several times. I've gotten moments where I just did not know the answer and I owned up to it and said I did not know. Some attendings want you to say a confident answer regardless whether or not you know the answer or not. But I have the belief that if I just tell you that I don't know, and I will learn it and I will know by tomorrow, I like that answer better for myself because it's going to make me remember that I need to go and learn that topic or that information about that question. But some attendings just rather you just say something confidently and stand on it and back it up, but I'm not sure about that. But yeah, just definitely be prepared to be pimped. I've been pimped several times already in the OR since I'm watching spine, and actually haven't done neuro yet in my medical school. We do neuro in the fall, but when I was in the OR, I got pimped about the layers of the spine and like the ligaments that are on it. I got pimped about cranial nerves. Like one of the patients had called in after a spine surgery and had said that they have been experiencing double vision and the surgery was nowhere near cranial nerves. And the doctor looked over at me and was like, "Hey, Hakeem, what cranial nerves are responsible for double vision?" And I'm looking at him like, "Oop, we haven't done neuro yet, but I'm not going to tell him that. I'm just going to give him my best guess." And I did, and I got it wrong. The cranial nerves that are involved with double vision: cranial nerve 3, ocular motor, cranial nerve trochanter, and abducens. Those are the ones. So if you ever get that question, those are the cranial nerves, the names at least, that are responsible for that. So I'm finally at the hospital. I'm about to go in and I'm about to start my day, go and change my clothes into my scrubs, and then head to the OR. Hope you all have a good day. Hope you enjoy this vlog. Peace out.